our panel. Good morning, this is Joanne Howard, and our panel is through the lens of diversity, equity, and inclusion. Sorry about our technical difficulties. Welcome. I'm Joanne Howard, and I'm the Associate Professor of Public Administration at the Stewart School of Business at Illinois Institute of Technology. I would first like to introduce our panelists. And so if I may, I'd like to have Dr. Helen Ezenwa is with Illinois Institute of Technology. She is the Assistant Dean for Student Services. Dr. Diane Howard is with Rush University Medical Center. She is the Chair of Health Systems Management. And Ms. Angela Freeman is a doctoral student and candidate at Northwestern University, and she also is in charge of a community organization at Rush University Medical Center. Our colleague, Dr. Leodis Scott from DePaul University, will not be joining us this morning because he has a family emergency. So welcome, everyone. We will be looking at diversity, equity, and inclusion, managing in a complex world. And so what I'd like to do is just present the context of our panel. You will see a slide in front of you that is from the front page of the New York Times. And so you'll see, a Marine colonel, he was passed over on 3 occasions for a promotion. Also an article in the business section indicating why are there so few Black economists at the Federal Reserve. The New York Times also did a study of the 922 most powerful people in America in terms of power, and they looked at 80% of the faces of power were white. And then even the Academy Awards, they had to expand the roster of presenters and people who were deciders because there were not enough people of color. So DEI, it extends throughout many categories. So I want to start with K through 12. K through 12 is an area that has touched all of our lives. And I want us to think back when we were in grammar school, middle school, or high school. Think about how many teachers of color you had in your classroom. And so there are domains of education and learning. In terms of our engagement, we have educators, we also have learners, but there must be a participation for people to learn with communities. We have to have, really strong academic leaders. The curriculum has to be strong, and we have to have engagement with family and, of course, students. And so we believe, the folks on this panel, that education is a human right. It's universal. Education should be free, and everyone has a right to it. And so you will see, in terms of pre-K through 12, we believe that educational leaders should be diverse. And if we think about students and they expressing their voices and ideas and innovation, they should also be diverse. And so I always tell this story. I used to work for an advocacy group that studied the 50 largest school districts in the country. And the person who was the executive director really wanted schools to be diverse from the administrators on down. And we recognize that students, they learn better when they are with diverse learners. So I am going to turn the panel over to Dr. Helen Ezenwa, and she will talk about higher education and her extensive research in that area.
We received feedback that the slide is moving, so we're adjusting that. Thank you. One moment, please. Mhm. So is this better? Are you still seeing some movement on the slide? If we can get some feedback, we would appreciate that. Feel free to open your mic if you need to.
Yeah, it's perfect now.
Okay, perfect. Wonderful. Okay, sorry for that. We will continue. So thank you for your participation and interest in such a relevant topic. As Dr. Joanne Howard mentioned, my name is Dr. Helen Ezenwa, and I'd like to focus on my portion of this discussion on the leadership in higher education. Briefly discuss the intersection of gender and race, as well as highlight the specific university experience in this area. Okay, so let's discuss leadership in higher education. According to the American Council on Education's 2017 president study, only 17% of college presidents in North America identify as racial minorities. Only 5% of college presidents are women of color. Given the rise of students of color and the importance given to representation to support retention of these students, one consideration impacting leaders of color is the cost of success of these leaders in comparison to their white counterparts. This as well as the limited wraparound support, student support, and limited underrepresented. I'm sorry, can you hear me? I just heard some interference, but this as well as the limited wraparound student support and limited underrepresented faculty and staff in the pipeline for senior leader positions that I observed motivated research in this area. What we set out to discover. The primary question in a recent paper that I completed asked what interpersonal and intrapersonal costs impact BRMI leaders as they ascend to the highest levels of university leadership, and how or if they differ from their white counterparts. To test this hypothesis, over 100 tenured or tenure track BRMI leaders in higher education were surveyed to evaluate the perception of the cost of this comparison to their white counterparts. There are some important results. BRMI leaders report that their work had greater costs to their family, friendships, community involvement, health, stress, self-care, and leisure than their white counterparts. And sponsor, coach, and mentor support only partially stem this cost. The theoretical basis of the study draws a few areas. How costs accrue for BRMI in a professional setting, stigmatization, discrimination, and bias, and disinterest to social relationships.
Hello, ma'am.
Stigma's cost to BRMI.
Sorry, ma'am. The slide hasn't changed yet, so we are not seeing what you're presenting.
Oh, the slide is not changing. So you're not seeing what we're presenting. Okay.
Thank you. Higher education, yeah.
Okay. Higher education is the last slide that they're seeing. So let's adjust that. Thank you for interrupting to share that. We're going to adjust it so you can see what we're presenting. Can you see theoretical implications?
Yeah, yes, we can see this now.
Okay. All right. Let me go back. Okay, this is where we want to be. Thank you. All right, let us continue. Sorry about that. All right, so we talked about stigma, we talked about bias and discrimination. I'd like to also talk about disinterest in social relationships costs, right? So the costliness of advancement of BRMI because of their comparatively weak to white social networks. Justification suppression theory describes how overt attempts to undermine stereotypes can jolt an observer into reducing their own reduced areas, as well as not only is there justification suppression theory, but then relevant to race and race-based prejudice. Black workers are perceived as more professional when they engage in code switching behaviors, such as adjusting their speech or styling to reflect white norms. Slide. I'd like to now discuss some key theoretical implications from the research. Career success must be factored into the cost, energy invested, cost of investment as the expense of personal growth, types of support to reduce costs, sponsor, mentor, coach, political skill connected to historically not being at the table, decision-making process, historically less exposed, and strengths, a unique and highly selective group of leaders in higher education. Regarding the research practical implications, results can be applied to hiring and retention of senior leaders in higher education. The research suggests that establishing a structure of support that includes access to a sponsor, mentor, coach could assist with managing the basic workload and consequently burnout of BRMI leaders. This research also supports inclusive leadership, as well as addressing barriers of time, barriers that have presented issues over time. During International Women's Day 2022, working closely with the Women in Business Education organization, I published an article for Harvard Business that looks at the biases and cost of success. When we talk about that, I really want to focus on understanding that we spoke to a number of business school deans globally and key types of support that can help underrepresented faculty that were investigated. Supporting women to reduce biases and the cost of success. We found that it was important to think about what might mitigate the success. Social support can come from a variety of relationships that provide emotional comfort or counsel, such as close friendship. Capital support is the richness and strength of one's political capital at work, and institutional support is the investment of one's employers in creating equitable and inclusive culture. Following these same themes of support and with a goal to address gaps as a result of the unrest that transpired throughout the US in 2020. Similar to many in industry, institutions of higher education also looked within to address underrepresentation in their communities. At our institution, unit-specific DEI committees were formed, as well as conducting a university-wide culture climate survey. Some of the goals that were elevated as a result of these actions are listed here. I'd like to briefly review these goals as well as outcomes. So when we talk about improving communication, there were a number of faculty, staff, and students that felt that communication from the most senior ranks were not just being disseminated across the university. And they wanted to build trust. They were hoping to demonstrate action and accountability, not just lip service. A commitment to ongoing transparency, inclusion, and justice, as well as a commitment to culture work. With regards to our outcomes, we launched communication training for not only the marketing and communication department, but for everyone who touched any written or verbal communication for the university community. The town halls were more transparent. There was additional information and metrics that were shared at every level of leadership. There was a need and a request for psychological safety that came from faculty and staff, and an ombudsman was put into place. University-wide committees focused on culture climate survey outcomes, as well as university-wide DEI training created spaces of belonging. Thank you for your time, and I would like to transition over to my colleague, Angela Freeman, to discuss community.
All right, thank you so much, Helen. So my name is Angela Freeman, and I'm going to talk about community partnerships and some of the work of Rush University Medical Center. So a few years ago, a baby born near Chicago's downtown Loop neighborhood was likely to live to be 82 years old. But in West Garfield Park, on the west side of the city, near Rush University Medical Center, life expectancy was just 70 years. These disparities reinforce the fact that where you live, work, and play can influence how long you live. While violence is often blamed for the disparities in life expectancy, more than half of the early deaths in under-resourced communities are actually caused by common conditions like heart disease, cancer, stroke, and diabetes. Morbidity and mortality from these and other health conditions are more prevalent in people living in neighborhoods affected by poverty, racism, and lack of access to healthcare, educational opportunities, and good jobs. In neighborhoods with equitable access to resources, there are fewer health disparities and people live longer. Even before the COVID-19 pandemic, each year, Chicago recorded more than 3,800 excess deaths among its Black populations compared to its white population. And COVID-19 exacerbated every inequity that drives that death gap. In line with national trends, life expectancy in Chicago dropped almost 2 years from 2019 to 2020, the first year of the pandemic. This finding represents one of the sharpest single-year decreases in life expectancy on record, and the steepest declines were for Black and Latinx Chicagoans. COVID-19 deaths were a significant driver of this trend. However, the virus was only the second leading cause of death in 2020 behind heart disease, which also increased along with other chronic diseases like diabetes. The city also saw higher than expected increases in deaths from accidents, so like overdoses or car crashes, and homicides. Life expectancy declines were seen in all races and nearly all communities. So now in 2022, that baby born in West Garfield has a life expectancy of only 68 years. When you examine the life expectancy map of Chicago, residents who live in close proximity to the city's academic medical centers have some of the worst health outcomes in the city. So clearly the answer is not just about improving geographical access to care, but also addressing the social and structural determinants of health, like poverty, systemic racism, gaps in educational achievement, food insecurity, housing and safety, which will have the greatest impact on improving community health. The pandemic has refocused attention on these perennial issues of equity and access, with a particular focus on rethinking and reimagining jobs and the workforce in a post-COVID reality. All sectors of the economy will need to assess the lasting impact of the pandemic on labor demand, workforce readiness, shortages, and resiliency. However, the healthcare sector must consider the long-term impacts of COVID from the perspective of both patient and provider. So how has the COVID-19 pandemic affected the healthcare workforce? And how will the pandemic reshape the healthcare workforce going forward? One potential solution to addressing these complex challenges facing our communities is instituting or adopting anchor mission practices. So anchor institutions are place-based, mission-driven entities such as hospitals, universities, and government agencies that leverage their economic power alongside their human and intellectual resources to improve the long-term health and social welfare of their communities. Some strategies that you'll see in these anchor mission approaches include directing a greater percentage of purchasing power towards local vendors, hiring a greater percentage of the workforce locally, providing workforce training for people needing assistance in the community, incubating the development of new businesses, leveraging real estate developments, and using pension and endowments funds to invest locally. So, encouraged by these alternative approaches to economic development, many institutions across the country are engaging with their surrounding communities to discover the best way to build sustainable ecosystems that support equitable outcomes and directly benefit local residents. However, harvesting the economic and social potential of these place-based partnerships requires deliberative community engagement to co-produce programming for systemic change. So if we're thinking about inequality and underrepresentation of people from historically marginalized communities, we know that that remains stubbornly persistent in science, technology, engineering, math, and the health science fields, or STEM-H. Students of color, first generation, or low income students who aspire to obtain meaningful post-secondary degrees, career success, financial security, and social mobility face tremendous challenges. Local systems and institutions are not adequately designed to address or sufficiently eliminate long-standing structural barriers for those navigating our STEM-H education and career sectors today. We present to you one model. So the Rush Education and Career Hub, or REACH, at Rush University Medical Center presents one model on how health systems' everyday operations can focus on measurable ways to address these attainment gaps and advance equity. So, recognizing that the healthcare field does not have enough leaders of color and that the field's diverse population deserves to be served and led by people who reflect that diversity, REACH inspires and empowers young people of color to see their potential and their place in healthcare, beginning in preschool and continuing through college and graduate study. So REACH utilizes a workforce intermediary model that joins an academic medical center with local elementary and high schools, community-based organizations, higher education institutions, and employers to increase and broaden STEM-H participation. We provide innovative, hands-on learning for underrepresented youth, cradle to career, to increase post-secondary achievement and diversity in the STEM-H professions through early and sustained access to high-quality STEM-H educational experiences, paid work-based learning, the ability to earn industry-recognized credentials, mentorship to facilitate participant engagement and promote program completion, and then also outreach community engagement, which is there to provide information, resources, and wraparound supports for not only the students, but their families and the community at large. And so through this, we're able to deliver academic enrichment, college preparedness programming, and paid internships to over 7,000 youth and young adults annually. And through this, we strive to really increase the diversity of physicians, address educational opportunity gaps, and cultivate the next generation of STEM-H professionals. And so when we look at the work that we do and we begin to evaluate it, we look at our primary outcomes of interest. Those relate to occupational identity formation, specifically demonstration of increased understanding and commitment to a STEM-H career. We look at college readiness and also their perceived value of the program. And so as you can see here, our findings convey that the program strengthened commitment to working in a STEM-H career by exposing participants to a broader range of options organizations and providing clarity around specific interests in the field. A universal theme of students that we spoke to on their experiences with the program was appreciation for the opportunities to learn, concrete medical skills, especially those that lead to certification. So for example, blood pressure, EKG, CPR, things of that nature. Furthermore, these credentials that they get as a part of our program were also viewed as strategic assets for future college and career opportunities. And our follow-up data indicates that 100% of Reach high school graduates enrolled in college, and 95% of those that enrolled indicated intent to major in a STEM-H field for the most recent academic year. So among peers building, these cradle to career programs, Reach is distinct for its position within Rush University Medical Center as an anchor institution and one of the largest employers on Chicago's West Side. So there is no, that's just one example of any number of models that are sort of looking at building out our cradle to career educational pipelines. And so there is no shortage of energy around these types of solutions. A growing number of organizations nationwide are working in communities to address challenges like the ones I've identified here. A very much needed movement, but a limited and potentially chaotic one if DEI isn't at least considered, if not embedded in every aspect of the work. Through the mission, we communicate the organization's reasons for being and how it aims to serve. The vision is our future-oriented declaration of what we want to become. However, a key element that spans mission and vision making is the work of arriving at a common understanding, whether that understanding is of who we are, what we're doing, or especially when talking about partnerships between these major institutions and their surrounding communities, how power and privilege have and continue to operate in these spaces, and how in some cases, these institutions have perpetrated harm to these same communities and that they're looking to collaborate with. So it requires us to be intentional in understanding the barriers of sharing power and or access that may have prevented people from coming and working together in the past, and how that may continue to influence the work today. Finally, several challenges to development and implementation success arise out of unique cultural and social norms that can impact program or intervention success and ability to scale. By implementing a multidimensional approach to engaging with communities, families, staff, and students, healthcare systems are better equipped to measure progress, hold teams accountable, and commit to the ongoing optimization of their stated DEI initiatives. In the process, organizations can also create positive, inclusive experiences that deeply impact the entire education continuum and workforce pipeline. And with that, I'm going to turn it over to my colleague, Dr. Diane Howard, to talk about healthcare.
Good morning. My name is Diane Howard, and I'm an associate professor and chairman of the Department of Health Systems Management at Rush University Medical Center. I want to put healthcare in context. We've talked about K through 12. We've then talked about higher education. And finally, Angela talked about community engagement with a specific reference to the REACH program at an academic medical center here in Chicago. Just want to share that the Centers for Medicare and Medicaid, they indicated that healthcare is a $4.5 trillion industry in 2022, and it will increase to $4.7 trillion in 2023. And it's almost 19% of the gross domestic product and will continue to grow. I want to put healthcare in perspective. There are generational issues that are impacting healthcare. In the 1940s, all the way to the present day, healthcare was initially viewed as a public good. Over the years, it's now viewed as a purchased commodity, and that has some issues for the population. So you can see the generations starting from the traditionalists all the way down to Generation Z. Their year of birth, the size, as well as the age of the population. But I think everyone could look at this issue in the context of their own fields, be it public administration, healthcare, or otherwise. There are national events that have impacted everything in the country. And you can see that we've gone through the Obama administration, the Trump administration, now we're in the Biden administration, but COVID has really impacted healthcare significantly, as well as the other parts of the industry. And then we've also indicated what are the major healthcare events. And then finally, what are the patient perspectives based on the generation in which they were born. So I want to share that in 1968, the American Hospital Association, which represents 5,800 hospitals in the country, had its annual meeting in Atlantic City, New Jersey. And one of their keynote speakers was Whitney Young, who at the time was the president of the National Urban League. He came to the American Hospital Association and challenged its leadership and members that healthcare, specifically hospitals, were the economic engines of their communities, and they needed to reflect that community. So when you heard Angela talk about what Russia's doing with the REACH program, that's consistent with what a number of organizations around the country are doing. So there are various interests that are in healthcare, and please be reminded that one of every $6 is spent on healthcare. So it is a huge part of the economic engine of this country. So you can see that the various interests include the federal government, employers, consumers, insurers, practitioners, provider organizations, and technology producers, all of which want the same thing. They want cost containment, and they want access as well as quality of care to the members. So when we look at healthcare, specifically looking at the medical model, which healthcare follows, you will see that there are various age groups that are in healthcare, and there are external as well as internal issues that are impacting those persons that are going into healthcare. So the ages before 30, 30 to 50, and then 50 and beyond, we've looked at the external and internal issues that are impacting them, which drives how healthcare is being delivered and how people view healthcare. With COVID, there are not a lot of professionals that are leaving the healthcare industry because they feel so incredibly exposed and exhausted. So we have to look specifically at how they're responding. So again, when we look at the personal insights, looking at how employers view young people under 30 and so on, this is clear what these search executives are looking for with young people that are entering the healthcare industry. And if we look at the drivers of healthcare spending and spending growth, you can see that financing and delivery are really important. Population needs, particularly as the population gets older, the boomers are starting to retire every 10 minutes in this country. Technology needs, and certainly with COVID, with telemetry and getting access to behavioral health and primary care, technology is having a significant impact. And the rest of the issues in terms of insurance design, cost quality, the competition and consolidation in the industry, the legal environment with so many lawsuits being brought against various providers. And then finally, the workforce supply, which is what Angela was talking about, to bring more people into the healthcare delivery. Because there are currently 13 million people that are employed in the healthcare industry. 1 million to 1.5 million are physicians. 3 million are nurses. The rest are support services like physical therapy, occupational therapy, and so on. Now, where does the money go? We've just indicated this. Primarily, the money is going to hospitals as well as physician services, over 50%. And so because these are the largest employers, this is where insurance companies try to go after and to reduce the expenditures there. But clearly, value-based healthcare is really on the march, and we'll see more home care being delivered. So these are the 9 future trends and that we see, and this is what we all have to look out for. There's a lot of quiet hiring where people are hiring people that they know, and this is something from a diversity, equity, and inclusion standpoint to make sure people of color are in that pipeline so they too can be quietly hired. And you can see the rest, but going down to number 9, Gen Z, there's a skills gap, and we've got to make sure, because of COVID, we make sure that they are coming into the healthcare industry and that we enhance their social skills, that they're not hiding behind computers and cell phones, but they're actually interacting so they can interact appropriately with patients when they move into the healthcare industry. Just want to give some brief remarks for the Obamacare, which is the Affordable Care Act, which really is promoting systemness in the healthcare system. We're moving away from fee-for-service to capitation. There's more coordinated care. And finally, the workforce dynamics are certainly there where people can work from home, but with healthcare, it's so important to have a patient relationship with their provider. And again, the healthcare workforce issues are there because the flexibility at work is really going to be important. And IT and sharing data, again, is going to be important. And you can see basically, again, $1 in $6 are devoted to healthcare in this country. You can see where the money is coming from and where it's going. So the total amount that health professionals give to various candidates are indicated. And what we're really going to have to look at is looking at the pharmaceutical and health products, in addition to hospitals, where the money is going and how it's being utilized to impact decision-making, particularly for various legislatures. And with that, I'm going to turn the agenda back to Joanne Howard so Dr. Howard can kind of give us some concluding remarks and open us up for Q&A with the audience. Thank you. So I'd like to turn our attention to nonprofit organizations because they are such a large part of the industry. And so there are more than 1.8 million nonprofit organizations in the United States. And so why does DEI matter in nonprofits? Because nonprofits, they were developed in the 1800s based on the religious denominations of people, and then they were assisting various communities. They have exploded, particularly in the 1970s. So diversity matters because it is a point of contact for so many organizations. And so, I want us to think about the nonprofit organizations that we interface with, religious organizations, social service organizations, hospitals, clinics, educational nonprofits. They're all over the place. And so we want to make sure that nonprofit organizations reflect the people in the communities in which they serve. It is so important, not only for the nonprofit, but also for their board of directors. And then we want to make sure that they mirror what's going on in the community. A perfect example, I worked with the University of Illinois at Chicago, and they had me lead an evaluation team of large tertiary care medical centers that were navigating patients throughout the various systems. And one of the things that we found were that people's health outcomes were much better when they interfaced with people that were a part of either their racial, ethnic, or religious group. So we found that to be really interesting. So there are three critical elements of collaborative community partnerships. And so every organization that works in a community needs to have a unified vision. And many of us, we know this because all of us, we work for organizations that probably have a strategic plan. So there has to be a common understanding and why we do the work. We also need to have institutional support. And so within the institution, there always has to be stakeholders who are at the highest level of the organizations to be the champions. And again, we always have to think about mission, and we have to address the gaps if the mission goes awry. So another perfect example, I'm working with a restorative justice program. And the organization has really grown very rapidly over the last 3 years. And so I've been meeting with their senior staff, and many other people have said, I think we're getting away from our mission. So I'm having them revisit their mission and then talking to people within the organization as well as their external stakeholders to make sure that everyone stays dedicated to the mission. So with nonprofit organizations, we all know this. There are opportunities and there are always going to be challenges. But again, I just want to recap. Everybody has to have the strategic vision in mind. And particularly the organization has to represent the communities in which they service. And then I always say this, what we value, we collect data about, and we look at the outcomes. So that always enforces what our decision-making will be. But again, the challenges are we always have to be responsive to our ability to sustain ourselves. And so I always try to suggest to the people that I assist, make sure that when you're having challenges, that you keep reporting back to the community in which you service and try to have quick wins. And so the quick wins can be when you're engaging with your community. So for example, there are food deserts in Chicago. And one of the groups that I worked with, they indicated there are food deserts in Chicago. So how can you get a quick win? You work with the political environment and you work within the political environment to make sure that people in the community let politicians know, we have a food desert here. Can't you get a grocery store here? And so that's a quick win when you can get people to commit to doing something. And then, it's hard to communicate the intangible. So you have to make your challenges an opportunity in order to advance what it is that you're doing. So there are implications, for all of the work that we do. There are organizational changes. The changes have to be cross-sector. We also have to have place-based strategies, and we have to have supports. So in order to really have cross-sector collaborations, you have to reduce disparities, and you're always having to promote equity. And then it's always beneficial to have public-private partnerships because, let's face it, nonprofits, they function in an environment where they always need money. So if you have private partnerships, you have the ability to sustain your operation. So lastly, I want to talk about conclusions and recommendations. In our work, Angela, Helen, Diane, and myself, we always are surveying and looking at what's going on in various environments. So we looked at, McKinsey & Company, Ford's, Businessweek, the Wall Street Journal, the New York Times. They have each indicated that DEI is a game changer and it can benefit organizations and communities. So lastly, I want to just kind of bring it all together to say our recommendations are communities and organizations need to unite for a clear vision. The backbone of any type of strategy, you have to coordinate and collaborate. Again, and you have to secure funding that is appropriate to what it is that you're trying to achieve. And I'm going to say this, all money is not good money. I've worked with organizations that are constantly trying to pay their staff. So they're applying for funding that really takes them away from their mission. So we all have to be very careful about that. And then to ensure accountability, again, you have to collect data. You have to meet with your internal and external stakeholders to make sure the organization remains on point. Have some quick wins for your stakeholders. And again, dashboard, 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 and update your stakeholders. So we have finished a little bit early, but I want to say to the audience, we're here and we'd like to chat with you about any questions you have, because we all have very interesting experiences in healthcare, community organizations, higher ed, as well as consulting and nonprofits. So anybody have any questions for us? So we're going to stop sharing so that we can see everyone in the audience. Would anyone like to pose any questions to us? Okay, so I'm going to just chat, again, about some of our experiences, so people know, where we are. I work, at Illinois Institute of Technology, but I also serve as a senior advisor to a consulting group. And we primarily manage nonprofit organizations that are in, healthcare, particularly restorative justice, education, and we really have a very tight-knit group of people that we work with. And so one of the things that we always try to determine when we meet with groups is that when we're talking about DEI, everybody's on the same page. So I'll give you a perfect example. We did an RFP to a group regarding restorative justice, but it was really interesting. Our group was really diverse. We had a young woman in the group who was Mexican, African American. We had a white male, and we had a Jewish woman that were in the group. And so all of us, we've really had unique experiences and circumstances. However, the people that were interviewing us did not feel as if we were at the appropriate end of the spectrum. So I'll leave it at that. I'll be diplomatic. And so they were saying, well, we're going to find it really difficult to put you in front of our people because we don't like the language that our consulting group was using. And so we withdrew from our RFP. We just said we don't want to be considered for the engagement. I'm going to say this to everyone: make sure that you're at one with the organizations that you work with, that you represent, or that you are giving advice to, because many times there's a disconnect with the communication and disconnect within and how people manifest relationships. So I just feel that is really important. Would any of my colleagues like to comment on that? Okay. So is there anyone in the audience that would like to ask a question?
Good morning. I'd like to thank all of you for the presentation. And my question, well, congratulations on the work that you're doing in your respective fields. I am at Albany State University, Albany, Georgia. And right now, our state legislature and governor looking at similar to what's happening in Florida and Texas, changing some of the diversity, equity, and inclusion language. Is your state facing any of that in terms of the legislature or executive office that would impact the work that you're doing around DEI?
Well, in Illinois, we're really lucky. Unlike Texas, unlike Florida, unlike states in this country where you have the chief, governmental person who is anti-DEI. In Illinois, we're very lucky. Governor Pritzker he has an African-American woman who is his lieutenant, governor. So we're really lucky in that regard. So no, we have not had those types of issues. I think that I'm going to say this, and I'm going to be really, maybe I'm making a lot of assumptions, but it appears to be in my role and the work that I've done, democratic, the people who believe in democracy from start to finish, whether they're at the governmental level, the mayoral level, or a local level. They have a tendency to really be responsive to their constituencies. So there are, the major city in Illinois is Chicago, and that's where the majority of the wealth is in this particular state. And so because we do have a Democratic governor, Chicago has a Democratic mayor, and we have like 50 aldermen who are responsible for different areas of Chicago, and the majority of them are Democrats as well. We don't have the issues that a number of other states have. So Veronica, I hope I've answered your question. Thank you.
Thank you, you have, and that's great. That's
Mhm.
great to operate in that type of environment and support.
Mhm. Anyone else? So I'm going to again call on some of my colleagues. Would you like to say anything about the areas in which you work? So I'm going to speak for my colleague who also is, she's an assistant dean at Illinois Institute of Technology. She's responsible for onboarding a number of students, and particularly with students who are international, who would like to remain in this country. She's responsible and does a fabulous job of placing people in opportunities that allow them to work in the United States for a finite period of time. And during the course of that time, they can apply for, work permits and what have you. And so many of the companies that she has access to, they will employ graduates of Illinois Institute of Technology and pay for them to remain in the country long term by paying for either J1, H1B visas and work permits so they can stay here. So we have a really interesting dynamic, and part of the reason why I think I have stayed in higher education so long is because you're working with people who are very intellectual. They've well-traveled, they have access to various people, and they're unafraid of people from different racial, ethnic, or religious groups. And so that is it can be really intoxicating and make you stay, in a community of learners because you're very, comfortable with the people. So anyone else have any questions? Okay, Diane, you need to unmute, Di.
Can you hear me now?
Yes.
Okay, I would just like to report on being at a medical center, and 15 years ago, we had recruited a senior vice president responsible for hospital operations. And can you hear me, Joe?
Yes.
Okay. And what he had come from Duke University, had worked in Singapore and the Far East, and he brought a diversity and inclusion initiative. And what was interesting, he did more for us in the 15 years he was here than had ever been done. He brought a diverse group of people, 50, to go through a training session with a consulting firm indicating their commitment to diversity, equity, inclusion, and then selected 25 people to serve on a governing body that would look at the university across its colleges, as well as the medical centers and hospitals that were a part of the system, to ensure that we were providing pipelines for people in the community, much like what Angela was discussing earlier, and bringing students into the university from the community to train them to be physicians, nurses, and allied health professionals. So you really have to have a concerted effort and a commitment on behalf of senior leadership to really move DEI through your organization. And we've all been together for 15 years, and it's been a marvelous success. Thank you.
Thank you, Diane. And so, we know that when people are trying to progress through different systems, it's really important that they have mentors. So I'm going to challenge everyone that's here to make sure that you reach your hand back to assist young people. I think that is really important. So I had the privilege of doing some consulting with a 2-year college. And so I always start out by asking the students, what are your long-term goals? And there was one individual in the classroom, he happened to be, a young Mexican male. And he said, I want to be a neonatologist. So I said, oh, gee, that's really interesting. He had done an internship with a neonatologist at Northwestern. But unfortunately, he was at a junior college that did not concentrate or would not give him the skills in science and math, when I knew that's what he really needed. So I just challenged him. I said, are you really good in science and math? And he said, yes, I'm really good at science and math. I said, oh, great. Well, I had the opportunity during this evaluation phase that I was going through with the University of Illinois. They had a summer program that was very intensive, and they wanted to outreach to undergraduate students to get them prepared to take, the MCAT, the DAT, and the GMAT so that they could get into graduate school. And so I said, why don't you apply to this program? He got in, and he had an 8-week, very intensive training class that allowed him to transfer to the University of Illinois. He has since graduated, and now he's in medical school. So I think it is incumbent upon all of us to make sure that we give, our colleagues who are younger than us the opportunity and the information to advance. Would anyone else like to share their experience? Because I think it's really important that we help to advance the generations that are behind us. Dr. White, I see you, and it's so good to see your face. I have followed your career for many, many years. I know you have something to give to us. Take your mute off.
I'm sorry. I said, thank you for the compliment. I'm just joining, so I'm not sure what is happening right now, but I'm always given an opportunity to expand my growth and my knowledge and development when I'm in a COMPA meeting. So I expect no less today as I listen and see what this next generation is going to develop and create for us. I'm excited.
Yeah, but can you share with us some of the work that you've done in the field to really advance the next generation? Because I followed your career for many years, and when I saw your name, I got really excited.
Well, thank you. Well, in terms of what I've done, I think I would declare myself as a pracademic. I've both written and published, but I've also practiced. I started off as a city manager in a small town, and that was my introduction to public administration right out of college. And from there, I went to work and teaching in an undergraduate public administration program. And while I was pursuing my doctorate, I went from there I went to Southern University. In fact, I published my first book while I was working on my doctorate with my mentor, Deal Wright, which was interesting because I tell the story. He made me read every article in the PA Times. I knew the field by the time I was ready to publish that book. But from there, I went to Southern, where I worked. And at Southern, I got involved in what we now call environmental justice, but it was no such thing then. At Southern, they had a hazardous waste incinerator in the community just surrounding Southern, where people were getting sick, children, church services were turned out. And my students and I did research, and again, trying to find out what was going on. And I got invited to what was called the Michigan Conference, where we had our first discussion of environmental justice. In fact, we had a fight over what to call it. Some people wanted to call it environmental ethics, or or environmental equity, and others of us wanted to call it environmental justice, or the debate where we settled on environmental justice. And for a number of years, I spent my life trying to help develop what we now call environmental justice. I published on that. EPA actually still uses California EPA, an article I wrote. But then I moved on from there to about every 5 years, I've developed a new focus. From there, I started looking at information technology. I've been very much concerned about that. And then from there, I went to look at what we call talent management. And I've written a lecture around the world on the issue of talent management. And I don't want to take too much time, but on talent management, why I still hear people talking about human capital, human resources, but we say human beings are not resources to be used up, and they're not capital to be owned. And more recently, I was in South Africa. By the way, COMPA helps establish something that I'm involved with now called the Consortium of International Policy and Development, International Management Policy Development. We're doing work in Africa, but that came out of COMPA. I was COMPA chair when we started that, and then became ASPA president later on. But while I was in South Africa, we had a discussion about artificial intelligence. So I spent a lot of my time now looking at the disparities created by artificial intelligence. In fact, I was on a panel on Thursday talking about that. So I like to think that my contribution to the field, again, has been a academic, demonstrating that it's not just about theory, but it's about practice, and trying my very best to make sure that the theory that we're developing, whether it's environmental justice or concepts about talent management or concepts about artificial intelligence, that they're actually applied, that we actually make sure there are policies out there that are going to implement the kinds of change or protections we think should be. And I've spent much of my time doing that. So let me stop there. I'm not sure that I fully answered your question. I just wanted to share a little bit about that.
Dr. White, thank you so much. You've been like, you don't know this, but you've been like a mentor to me in absentia, because I've followed your career.
Well, thank you. You're
for
too
a long
kind.
time. And I see some other names that I recognize, but I don't want to embarrass anybody. Would you like to kind of share your experiences with the audience? Because I think it's really invaluable that we do that, because you never know who's in the room.
Mm-hmm.
And just like, I've followed Dr. White's experience for years. I would hope that someone else would like to share their experience, because you never know whose life you're going to touch. Mm-hmm. Like I say to my students when I'm in class, don't make me call on you.
Now, you didn't hesitate to call on me, so I suggest you call on people.
Okay.
And invite them. I'm saying they could always decline, but I certainly think it's appropriate to invite people to share.
Francis, can I call on you, because I've seen your name over the years at different ASPA and COMPA events. Would you like to share with us, share your background with us? Or anyone else who would like to just jump in?
She may have walked away.
Okay.
But I see there's Patricia. I think she's another COMPA past president.
Yeah, I see. Oh, we have a person who's raised their hand.
Ah.
Renisha,
Hello.
hi there.
Good morning. I'm Renisha Blake. I'm currently studying my PhD in public administration and urban policy at Old Dominion University. And I really found the information that you shared insightful. And this is because I'm also conducting research as it relates to technology in the field, specifically in public policy, because over the years, what I found is that most governments globally are using technology to digitize and to transform their work to make it, subscribe to good governance, the efficiency, the transparency, etc. And so when I heard you talk about technology, I got pretty excited just to hear about the work that you're doing. And specifically when you mentioned, not just in government, but in nonprofits as well. So I'm just going to tell you specifically what my research entails. And perhaps if you have anything to share on perhaps how I could advance my research or other factors that I could include, that would be great. So currently, I'm in coastal Virginia, and my research is entitled Governance Framework. So I'm looking at information and communication technology integration into coastal resiliency frameworks.
Mhm.
Right. And I started out doing research in Virginia on the coastal resiliency here, but I'm from Jamaica. And so initially, when I started out doing my dissertation research, I said, okay, I think I should do a comparative study between Jamaica and coastal Virginia. But then when I looked, there wasn't enough empirical data or evidence in Jamaica or the Caribbean to even compare or to create a case between coastal Virginia and Jamaica. And so now my study is primarily on Jamaica. And I mean, there are several challenges as it relates to ICT integration that I've found, just the budgeting aspect and of it being a major part, the training, the need for capacity development. I've found several things, but there are also several opportunities. So my question to you is, over the years, working in the field and working with technology within several sectors, what are some of those like opportunities that you see come back like over and over again, the repetitive ones that you think could apply to individuals across several fields or sectors? I know it's a mouthful, but so just to repeat the question, what are some best practices or opportunities that you think is good when implementing technology, whether it's in the nonprofit sector, the public, private, those sectors that you've specifically worked in?
So Dr. White, I'm going to start out and answer the part of the question, and then I
Sure.
want your help in answering the rest.
Sure.
I had a similar situation, Ronisha. I worked at a medical center, and they wanted me to do an evaluation of 40 years of their outreach to the community. And I recognized they did not have good records. So what I did was I did an environmental scan of what they had been doing. And I just started interviewing people and collecting data for them, and had talked to people who had been introduced to the program 40 years ago up to the current. And what I did was I started to make a database for them, and then I helped them to advance the database. So sometimes what you have to do is you have to create that opportunity, take that opportunity, and you just create something on the ground that other people that are coming behind you can build on. So Dr. White, I'm going to toss it to you because you've had more experience with that than I have.
Yeah, I'm trying to put this in the proper context. I've had to deal with, let me back up. The mere fact that you said information technology, IT, the C you added to it, we don't do that in America. So I knew you had to have some experience outside this country, because in America, we don't think of the communication part of IT. But when I go to Africa and the Caribbean, my wife is from the Caribbean, by the way. So I hear that. So I understand trying to deal with, I guess, Virginia versus Jamaica. But let me back up and just share a couple of things that I've gone through in my life. I was in Alabama working as a special assistant to the president of the University of South Alabama and head of a center called Health Communities along the Gulf Coast when Katrina hit. One of the problems we had in Mobile, and I could go back to my experience at Southern, but let me just talk about Mobile. After Katrina, we found that all the health records had been destroyed because all of the federally funded health centers had been destroyed along the Gulf Coast. And we had no way of getting patients' records. So we started off trying to help create health records for people that they could access anywhere in the world. And what we did then, we went to churches and said to churches, look, if there's one place that people can perhaps relate to, let's make sure that people have access to that technology through you. So we had helped churches set up websites that people could actually upload their health records. And we worked with a firm out of Cleveland to do that. Now, we picked 12 pilot churches to test to see if that would work. Now, I left Mobile about 2 years later, so I'm not sure that they continue that. But I go back to what you've said. Sometimes you have to set up pilot projects to see.
Mhm.
Now, that costs money, of course, and I'm not asking you at this point in your career to do what we did, but you don't have to have an elaborate, you can have just a few samples and create some case studies, and then infer that if these case studies are typical, and then make inferences from those case studies. So you don't have to have 300-400 samples. You can actually have a few case studies in detail and use those case studies to make some inferences. And with the claim that if these case studies are representative, then these are the findings out there, and perhaps these are some policy implications for those case studies. So I would suggest, if you nothing else, create some case studies around information technology, and whatever you find that interests you, I would say let that drives your passion as well. Beyond mine was healthcare, but in criminal justice we did some things as well. But let your passion decide what you want to do. But also, don't think you have to let this be your masterpiece. What you want to do is get enough data to finish that dissertation, and then once you have that PhD behind your name, that's when you can do your masterpiece.
Thank you, Dr. White. Dr. Howard, you had your hand up?
I did. Thank you. I just wanted to share that I'm on the board of the American Hospital Association's McGall Prize Committee. And what we do, we fly around the country to identify the #1 hospital in the country every year. And what was amazing to us this year were how many rural hospitals in not only Virginia, but in Maryland and in North and South Carolina that didn't have internet capabilities. So with your IT expertise, you may even want to look at hospitals in terms of allowing senior citizens and different people to get access to healthcare delivery. But what happens when they don't have access to the internet because they don't have those capabilities in that area because they're in a rural area? So you may even want to work and try to understand a little bit better what's going on in some of these legislative areas so that you can raise the visibility in that area. So just an idea.
Thank you. And Ronisha, I think you have your hand up.
Yes, thank you. Just to respond to Dr. White, I think you hit the nail on the head with several things that you spoke about, specifically, ICT being, well, when I see ICT, I realize that it's more used within a developing country context more so, and also like within small island developing states, etc. But I think you've also gave me a great idea for post PhD, because as you rightfully said, this is not a masterpiece. My professor always say a good dissertation is a done dissertation, and so I've already submitted my dissertation. I'm currently working on my reviews, and I'm looking to defend next month. But I'm already thinking ahead to say, okay, what do I really want to research? Because I want to publish more as well. And I see right now, I think I'm positioned to be more in a practical role. So I still want to be able to still do my own research while I'm doing that. So I will look at those cases that you mentioned, start to look at cases. And Dr. Howard, what you said as well, relating to just ICT and technology being used in the medical field. I worked with the RAFT, which is the Resiliency Adaptation and Feasibility Tool here in Virginia. And one of the things that we found in Virginia's Northern Neck was that when you have individuals like medically fragile, vulnerable groups, etc., we have to take account for those individuals as well, whether it's homeless populations, etc. And the work that I do also broaches wicked problems. So I think that's a good context within which I'll start to at least get these case studies out. So thank you both so much just for, just the insights that you've given me. And this will definitely propel my research and help to guide me as I advance from the PhD to my own research in the field. So thank you very much.
Thank you.
Well, thank you. And congratulations. We'll be following your career. So Francis, anything that you would like to add? I followed your career for many years too. Just so that you all know, I've been a member of COMPA and ASCA for 45 years. So I know the long-term members.
Well, I can also relate to the lack of medical facilities here in Mississippi. There are a lot of counties that don't have hospitals, and it's very difficult to get them when you have a person needing medical attention, especially if it's an emergency. It's almost fatal if, when they try to get to a hospital. So I think the state is trying to do something about that, and hopefully we will see some changes.
Yeah. Wow.
Agreed. Donovan, I see you on the screen. Do you have anything to add to our conversation?
Don't mute.
Yeah, I just had to click that button. But good morning, and thank you, Angela, for allowing me this space. And congratulations to you, Miss Blake. I do agree. A good dissertation is a done dissertation. And Dr. White, you were spot on when you said once you complete, then you can start working on your masterpieces. I think that you have the right mindset. And I wish you the best, and I'm sure you'll be successful in all of what you do. So again, congratulations, and thank you, Angela, for affording me this short space. Thank you so much.
So I see that we are coming to the end of our session, and I want to make sure that we don't outlive our session. Is there anyone else that would like to say anything for the good of the order before we end? Patricia, I see your hand up.
Yes, hi everyone. I just wanted to just say thanks as he concluded. It has been very wonderful, and thanks Harvey. Like you said, he's been a mentor to so many of us. So I just really appreciate that, and I just wanted to say something before you ended. So God bless you all, and I look forward to seeing you all again.
Harvey, I just want to say hello to my dear friend, to see your face, and I'm sorry that my computer is doing all this zigzagging. I don't know what the problem is, but it's good to see you. You know, we go way, way, way back.
We do go way back. Let me, if I may, Madam Chairperson, it's nice to be a mentor, but what makes you feel good when you see people who are in a position to do and carry this organization forward and make a difference. Some of us struggle for years with COMPA, but I feel very, very pleased, and it's gratifying to know we have such young, vibrant talent that's in this organization today. And we're here. We're not going any place, but we're going to step back and let you guys lead. Mr. President-elect to be, we're excited about your role, immediate past president. So no, this is an exciting time in the life of this organization. It has a rich history, but I think it has an even richer future on the leadership of the team that's in place today. So thank you all for what you're doing and what you're going to do.
And on that note, I hope everyone has a lovely weekend. Thank you so much for attending, and we look forward to seeing everyone in the future. And best of luck to our new president, our president-elect. Take care, everyone.
And I see some people hopping back into the main session.